Bismillahirrahmanirrahim. Dear student, welcome to the course Pharmacology and Therapy. I am Fawad Ali, Assistant Professor, Department of Pharmacy, Guwahati University of Science and Technology. Today, we will discuss about an antibiotic group which is tetracycline. Outlines. In today's lecture, we will discuss the following content one by one, like tetracyclines, its history, classification and chemistry, effect on pathogenic microorganisms, bacterial susceptibilities, mechanism of action, mechanism of resistance, pharmacokinetic, therapeutic uses, and unwanted effect. Lecture outline. After watching and listening, student will know about tetracycline mode of action, its resistance, clinical use based upon its spectrum, and unwanted effect. Okay, history. Chlortetracycline, the prototype of this drug, was introduced in 1948, but this is no longer marketed in United States because of this activity, because their activity against Rickettsia gram-positive and gram-negative bacteria, because they have activity against the gram-negative, gram-positive, Rickettsia, aerobes and anaerobes and chlamydia. Tetracycline became known as the broad-spectrum antibiotic. It is broad-spectrum antibiotic. This is basically the structure, the basic nucleus of tetracycline. Tetra means four and cycle. They have basically four cycles, tetracycles, 1, 2, 3, 4. So the name indicates because they have four cycles in their basic nucleus. These are different tetracycline, chlortetracine. These are substitute at 7 position. The substitution at 7 chlorine, then it becomes chlortetracine, oxytetracycline, OH at position 5. This is like OH and hydrogen. Demiclocyclines, so they have different substitute at 6 and 7 region. And metacycline, they also have a substituent like OH, H, CH2 at 5 and 6 position respectively. CH2 at 6 position and OH and H at 5 position. This is okay. Doxycyclines, these are they have substituent like O and H at 5 position and CH3 and H at 6 position. Minocyclines, they have substituent like hydrogen at 6 position, and they have hydrogen, and this methyl nitro group at 7 position. Effect on pathogenic microorganisms. Tetracycline are bacteriostatic antibiotics with activity against a wide range of aerobic and anaerobic gram-positive and gram-negative because that's why they're also known as a broad-spectrum antibiotic. They have a wide spectrum. They also have effective against some microorganisms such as Rickettsia, Mycoplasma, pneumonia, Chlamydia, Legionella, some atypical mycobacteria and Plasmodium species that are resistant to cell wall active antimicrobial agents. Democlacine, tetracycline, and oxytetracycline, minocycline, and doxycyclines are available for systemic use. Chlortetracycline, and oxytetracycline are used in ophthalmic preparation. The more lipophilic drug, minocyclines and dipsaclines, usually are most active. They are more lipophilic drug, minocycline and doxycyclines. Resistance of bacterial strain to any one member of the class may result in cross resistance to other tetracyclines. So they have cross resistance among the group. Bacterial susceptibilities like tetracycline intrinsically more active against gram positive than gram negative, but acquired resistance is common. They have more intrinsic activity against the gram positive as compared to the gram negative, but acquired resistance is common. Susceptibilities of the staphylococci and pterococci and hemolytic streptococci are variable, like Bacillus anthracis and Listeria monocytogenes are susceptible. H. influenza are generally susceptible. but many enterobacteria have acquired resistance. They uh, acquired resistance. Although all strains of Pseudomonas aeruginosa are resistant to the tetracycline, most strains of the Brucella are also susceptible. The tetracycline are active against many aerobic and facultative organisms. So they have broad spectrum, they are active. They have activity against multiple microorganisms. Rickettsia. All tetracyclines are highly effective against the Rickettsia. Miscellaneous microbes. Tetracycline are also active against chlamydia and mycoplasma. Some non-tuberculosis strains of mycobacteria, like Mycobacterium marinum, also susceptible, sensitive to the tetracycline. Effect on the intestinal flora. Many of the tetracyclines are incompletely absorbed from the gastrointestinal tract, and their high concentration in bowel can markedly alter the enteric flora. Like for example, tetracyclic lesion produce pseudomonas colitis, usually caused by the Clostridium difficile, as the result of because it alter the enteric flora. Mechanism of action. It is a protein synthesis inhibitor. It is bacteriostatic drug. Tetracycline inhibit the protein synthesis by binding to the 30S ribosome and preventing the excess of amino acyl transfer RNA to acceptor A site on the messenger RNA ribosome complex. We'll discuss in the next diagram. So it basically prevent the excess of the amino acyl transferase RNA. These drugs enter the gram-negative bacteria by passive diffusion through the hydrophilic channels formed by the porine proteins of other cell membranes and by active transport via an energy-dependent system that pump all tetracycline across the cytoplasmic membrane. Entry of this drug in gram-positive bacteria require metabolic energy, but is not as well understood as like in gram-negative organism. So this is the inhibition of bacterial. They call tetracycline causes inhibition of protein synthesis. How? Like messenger RNA attaches to the 30 ribosome. This is the messenger RNA attaches to the 30 bacterial ribosomal RNA. The P peptidyl side of the 50S ribosomal RNA subunit contains the nascent polypeptide chain. The P site. This is the P site. They contain the nascent polypeptide chain. They contain the nascent polypeptide chain. This is the nascent polypeptide chain. Normally, the amino acyl transfer is charged with the next amino acid. The amino acyl transfer is charged. This is amino acyl charged with the next amino acid to be added to the chain moves into the A site. This is like they move toward the A site, which with a complementary base pairing between the anticodon sequence of transfer RNA and codon sequence of the messenger RNA. Because it is basically complementary base pairing between the sequence of RNA and tetracycline basically inhibit the bacterial protein synthesis by binding to 30 subunit and blocking the transfer RNA binding to the A site. Basically, they binding the amino uh, transferase to A site. This is they block the binding of the transfer RNA to the A site. The resistance to the tetracycline is primarily plasma mediated and often is inducible. The three main characteristics of the mechanism are decreased accumulation of tetracycline as a result of either decreased antibiotic influx or energy dependent efflux pathway. Production of ribosomal protection proteins that displaces the ribosome from its target. A protection that also may occur by mutation. Well, simple by mutation, they have some mutation in the binding site of the tetracycline. Enzymatic inactivation of tetracycline. Cross resistance or lag, therefore, among the tetracycline depend upon which mechanism is operated. For example, Staphylococcus aureus strains that are resistant to the tetracycline on the basis of efflux mediated by TAC still may be sensitive to the minocycline. So, tetracycline resistance due to the ribosomal protection mechanism produce cross-resistance to the doxycycline and minocycline because the target site protected is same for all the tetracycline. So, the enzymatic integration of the tetracycline cross-resistance will depend upon which mechanism is operative in the resistance. That will result in the cross-resistance or not. Absorption. Absorption is incomplete. Tetracycline absorption is complete. The percentage of the absorption vary. Like low tetracycline 30%, intermediate for oxycycline, demaclocycline and tetracycline have 60 to 80%, and high for the doxycycline 95 and minocycline 100%. So the percentage of unabsorbed drug rises as the dose rises. Absorption mostly take place in the stomach and upper intestine and is greater in fasting state. Absorption of tetracycline is impaired by concurrent ingestion of the dairy products. They have interaction with the dairy products and some metal like ammonium hydroxide, gel, calcium, iron, or zinc salt, and bismuth salicylates. Thus, milk products, dairy products, antacid, Pepto-Bismols and dietary iron or zinc supplement interfering with the tetracycline absorption. The decreased absorption appears result from the chelation of divalent and trivalent cations. They basically produce a chelation, so contraindicated. When we use tetracycline, special precautionary measures should be taken, do not use any dairy products or different antacids and metals like ferric, zinc, and aluminum, etc. salts. Distribution. While they are widely distributed throughout the body, secretions, urine, prostate, they accumulate in reticular endothelial cells of liver, spleen, bone marrow, in enamel of unerupted teeth. Inflammation of meninges is not required for the passage of tetracycline in the cerebrospinal fluid. Penetration of these into the most of the fluid and they can easily cross the CSF. They don't require inflammation of meninges like in specifically in penicillin. If they not cross the blood-brain barriers, but in case of the inflammation of meninges, they mostly cross the blood-brain barrier. Tetracycline cross the placenta and enter the fetal circulation and meiotic fluid. Relatively high concentration of these are also found in the lactating woman's breast milk. Excretion. With the exception of doxycycline, the primary route of elimination for the most tetracycline is kidney, although they are also concentrated in the liver and excreted in bile. After the biliary excretion, they are partially reabsorbed via the enterohepatic circulation. Elimination via the entire intestinal tract occurs even when the drugs are given parentally. Minocycline exception is significantly metabolized by the liver. Therapeutic reason. They have infection in rickettsia, like tetracycline effective and may be life-saving in rickettsia infection. Mycoplasma infection. Mycoplasma pneumonia, they are effective in rickettsia infection, like it is also considered life-saving drug in the rickettsia infection. Mycoplasma infection is sensitive to the tetracycline. Like we discussed in the spectrum of the bacterial susceptibility of the tetracycline, they have effective against the mycoplasma pneumonia. Treatment of pneumonia with tetracycline shortens the duration of fever, cough, malaise, fatigue, muscle pain, pulmonary raise, radiology abnormalities in the lung. Mycoplasma may persist in the sputum after cessation of therapy. Despite rapid resolution of the active infection, they are present in the sputum after cessation of the therapy. They are also effective in the chlamydial infection. Trachoma effective, tetracycline, doxycycline, and tetracycline effective for this infection. This is trachoma infection. However, this disease is important in early childhood before the complete calcification of the permanent teeth. And the tetracycline, therefore, often are contraindicated because they cause it, the teeth discoloration. Azithromycin, which is effective as a single dose, is preferred in the trachomatic infection. Non-specific urethritis. Normally, it is often due to chlamydial trachomitis. Doxycycline is effective, however, azithromycin is preferred in non-specific urethritis in a single, usually given as a single dose. Sexual transmitted disease. Because of resistant doxycycline no longer is recommended for the gonococcal infection because they required against the resistance against the gonococcal infection. If the co-infection with the chlamydial trachomatis has not been excluded, then either doxycycline or azithromycin should be administered in addition to agent effective for the gonococcal urethritis. This is like, for example, and against the sexual transmitted disease because of gonococcal infection. Doxycyclines are effective if the co-infection with the chlamydial trachomatis in case of, so either doxycycline or azithromycin are administered in addition to an effective agent for the gonococcal infection. And this is the Center for Disease Control, the reference of the specific this paragraph. Anthrax. Doxycycline is effect indicated for prevention or treatment of anthrax. The recommended duration of this dose is 60 days for exposure occurring as an act of bioterrorism. This is an act of used as a bioterrorism. So the effective drug for the anthrax is the doxycycline, and duration is for 60 days. Bacillary infection. Effective bacillary infection, effective in brucellosis, in combination with rifampicin, tetracycline in combination rifampicin and streptomycin are effective for acute and chronic infection caused by brucella. Cholera. Doxycycline is effective in reducing the stool volume and eradicating the vibrio cholera from the stool within 48 hours. Antimicrobial agents, however, are not substitutes for this fluid and a right replacement in this disease. In addition, some strains of the Vibrio cholera are resistant to tetracycline. Other bacillary infection, like therapy with the tetracycline, is often ineffective in infection caused by the Shigella, Salmonella, or Enterobacteriaceae. They are not they are ineffective in the Enterobacteriaceae because of high prevalence drug resistance against the enterobacteriaceae. This which limit the use of the tetracyclines, the use because in the enterobacteriaceae species, for example, enterobacteriaceae causing traveler diarrhea. The use of tetracycline in case of the traveler diarrhea because of resistance, it decreases the use of tetracycline. Coccal infection. Because of resistant tetracycline fell into the disuse for infection caused by staphylococci, streptococci, meningococci, because they have produced resistance against these. However, the community strain of methicillin resistant staphylococcus aureus often susceptible to tetracycline, doxycycline, and minocycline, which appear to be effective for uncomplicated skin and soft tissue infections. Approximately 85% of the strains of the Staphylococcus pneumonia are susceptible to tetracycline and doxycycline and remain effective agent for the empirical therapy of the community-acquired pneumonia. So the reference Bartlett et al. In 1998. Urinary tract infection tetracycline are no longer used for the urinary tract infection because their entire organism cause the infection, including E. coli, and they produce resistance against the enterobacteriaceae and E. coli's enterobacteriaceae. Acne. This is as used to treat the tetracycline have been used to treat acne. They may act by inhibiting the propionic bacteria which reside in sebaceous follicles and metabolize lipids into irritating fatty acids. The relative low dose of tetracycline are used for acne apparently are associated with this side effect like sulfonamide also used in this acne. Unwanted effect like gastrointestinal. Tetracycline produce gastrointestinal irritation most commonly after oral administration. This causes epigastric pain, burning, distress, abdominal discomfort, nausea, vomiting, and diarrhea. The tolerability can be improved by administering the drug with food, but tetracycline should not be taken with the dairy products or antacids because they produce chelates, divalent, trivalent chelates. So they have been associated with esophagitis, esophageal ulcers, and pancreatitis. Pseudomonas colitis caused by the overgrowth of Clostridium is a potential life-threatening complication because it also affects the enteric normal flora. Photosensitivity. Dimeclocycline, doxycycline, and other tetracyclines to a lesser extent may produce mild to severe photosensitive reaction in the skin of treated individual exposed to the sunlight. So, onycholysis and pigmentation of nails may develop with or without accompanying photosensitivity. Most of the tetracycline causes the patient treated with tetracycline produces photosensitivity is common. Hepatic toxicity. Oxytetracycline and tetracycline are the best hepatotoxic. Are the least hepatotoxic of these agents. Develop in patient receiving 2 grams or more of the drug per day parenterally normally, but this effect also may occur with larger quantity administered orally. Pregnant women are particularly susceptible to tetracycline induces hepatic damage. So renal toxicity. Tetracycline may aggravate exothermia in patients with renal disease because of its catabolic effect. Doxycycline have renal side effects than do other tetracyclines. Nephrogenic diabetes insipidus have been observed in some patients receiving demiclocyclines, and this phenomena has been exfoliated for the treatment of syndrome of inappropriate secretion of antidiuretic hormones. Fanconi syndrome, characterized by nausea, vomiting, polyuria, polydipsia, proteinuria, acidosis, glycosuria, has observed in patients ingested outdated and degraded tetracyclines. So these presumably result from a toxic effect on the proximal renal tubules. Effect on teeth. Children receiving a long or short-term therapy with a tetracycline may develop permanent brown discoloration of the teeth. The larger the dose relative to the body weight, the more intense the enamel discoloration. The duration of therapy appears to be less important than the total quantity of antibiotic administered. The risk of this unwanted effect is highest when a tetracycline is given to the neonates and babies before the first dentition. However, the pigmentation of the permanent teeth may develop if the drug is given between the age of 2 months and 5, when these teeth are being calcified. The deposition of the drug in the teeth and bones, probably due to its chelating property and formation of tetracycline calcium orthophosphate complex. This is because the discoloration is because of the tetracycline calcium orthophosphate complex. Treatment of pregnant patients with tetracycline may produce discoloration of the teeth in their children. The period of the greatest danger teeth is from mid-pregnancy to 4 to 6 months of the post-natal period for the deciduous anterior teeth and from a new month to 5 years of age for the permanent anterior teeth. When the crowns are being found, our children up to 8 years old may be susceptible to this complication of the tetracycline. So, in the children under 8 or 10 age, tetracycline should be contraindicated in the children. Miscellaneous effect. Tetracycline are deposited in the skeleton during gestation throughout the childhood and may depresses bone growth in premature infant. This is rarely reversible if the period of exposure to the drug is short. Thrombophlebitis is frequently follow intravenous administration. Long-term tetracycline may produce leukocytosis, typical lymphocyte, toxic granulation of granulocytes, and thrombocytopenia purpura. Patients receiving minocycline may experience vestibular toxicity manifested by dizziness, ataxia, nausea, and vomiting. Long-term use of the minocycline can pigment the skin, producing a brownish discoloration. Various skin reaction urticaria rarely may follow the use of any of the tetracycline. Among the most severe allergic response are angioedema, anaphylaxis, anaphylactic reactions can even after the oral use of these agents. Other hypersensitivity reactions are the burning of eyes and pruritus. Thank you. This is with this um, chapter is basically the next antibiotic is basically taken from the Goodman Gilman book. Thank you. Thank you so much